Hi, my name is Melanie Harned, and I am the developer of the DBT Prolonged Exposure protocol for PTSD.
And I am Annie McCall, lucky and frequent co-trainer of Melanie Harned and the DBT PE protocol. And we are actually here in this moment to tell you about the advanced training in DBT PE that British Isles DBT has graciously invited us to come and do. And so we want to tell you a little bit about what happens at that training, and help you get interested and maybe a little less nervous if you're a little bit nervous about showing up and saying, oh no, the treatment has turned out to be trickier than I thought. So, Melanie, will you talk a little bit about what happens at this training?
Yeah, so this training is intended for people who have already come through our regular 4-day intensive training in DBT PE and really have that foundational knowledge in place, and have already been out sort of using the treatment with at least a client, maybe a handful of clients, and are hoping to get just some extra knowledge as well as some extra support and consultation. I think one of the hardest things about doing an intensive training is sort of you come out of that. Often people are pretty excited about using the treatment. They feel like they got a good grasp on all that core knowledge. And then you get out there and start encountering real clients and running into some sort of just tricky situations. This is a complex client population, and it's not as straightforward as it might at first blush seem like it would be, particularly because of the protocol nature of it. I think it's sort of like, well, this is what we're supposed to do in each session, and this seems like I can do that. And then the real world kind of comes into play and things are a little bit harder. And so that's what this training is really for, is to help kind of fine tune as well as help you sort of better be able to sort of think through and navigate some of the challenges that happen when we're trying to do a trauma treatment with really, really complex clients.
So it sounds like then part of the structure really is individual attention on cases, specific questions. I don't know how to structure in vivo for this, or I'm having a hard time, can't figure out why something isn't changing. So it's really specific to therapists who attend and their own personal sticky spots with actual clients.
Yeah, it is. And so we are not going to do like a basic review of the things that were already covered in the original intensive. And so we can just look for a minute at the goals of the advanced training, which are really to sort of improve your own adherence and competence in delivering DBT PE. And a key part of that is we really want to help people get better at the skill of case formulation, and then be able to use a case formulation to guide your treatment. When you run into a tricky problem in treatment, case formulation is what saves us a lot of the time, sort of being able to make principle-driven decisions that are going to be effective for this specific client. And so we're also going to talk about in the advanced training, sort of how to tailor the delivery of DBT PE to characteristics of individual clients, both from that sort of case formulation approach. You know, what is it for this person that needs to change in order for their PTSD to improve? As well as we're going to spend some time, we'll talk about working with clients from marginalized populations, racial or ethnic minorities, LGBTQ populations, for example, as well as some information about working with adolescent clients or people whose primary trauma is traumatic invalidation, which sometimes poses some sort of different issues that will come up in treatment. And as you were saying, Annie, you know, we're going to encourage people to submit cases to receive consultation on, which we can talk a little bit more about here, but where we are going to talk about the problems you're actually running into with your clients. Some people will present cases and get really in-depth consultation at the training for everyone to learn from, because you are not going to be the only person who has run into these kinds of problems.
What if hearing about presenting a case in front of a bunch of colleagues and trainers kind of makes me want to barf?
Yep.
I feel like half the world is like, oh, no, I don't know about that.
Yeah. Well, then, first of all, I'd say that's very normal. And, you know, generally public speaking, but certainly presenting your work in front of colleagues. And you will probably not be surprised to hear that I'm going to say also, what a fantastic opportunity for exposure, right?
You
But
always say that.
right, because it's true.
Also that.
But with the case presentations, I really encourage people to do it because I think, again, one of the hardest things is you get all this workshop training and then you go out and without potentially having the support and the consultation to really think through specific cases. And I really encourage people both to submit cases, but also to pick your hardest ones, like the things you think are bombing, is what I really recommend that we could do consultation on, because there's just so much learning there. I'll learn things from you all with sort of different cases than I've maybe encountered exactly, and we can all put our heads together and think about choices and what might make sense. And so that is both hard and I think likely to be incredibly helpful.
And I would add to that we will not be as judgmental about your struggles as you likely are. That the things that make it hard to come forward and say, oh, I think I drove this into the ditch, we're likely to say, oh, I know that ditch really well. Here's how to get out of that. So our hope is that we see lots of you there. And there will be information certainly on the British Isles DBT website about how to register. So come and let's help you expand your DBT PE practice with your hardest folks. Anything else you want to add to that, Melanie?
Yeah, I'm looking forward to nerding out with you all about trauma treatment. Let's get in there and figure out how to make this work for your really hard cases.
Exposure works.
Thank you, everybody.
Thanks.